Hello, and welcome to Breast Cancer Conversations, a podcast brought to you by SurvivingBreastCancer.org. I am Laura Carfing, breast cancer survivor and founder of SurvivingBreastCancer.org, a nonprofit organization providing community, education, and resources to empower those diagnosed with breast cancer and their caregivers from day one and beyond. Hello, and welcome to another episode of Breast Cancer Conversations. I am so thrilled you are joining us today, and boy, do we have some exciting news to share. I am joined with Sanya Bawa. Sanya is a student at Johns Hopkins University, and she has been interning with SurvivingBreastCancer.org for several years now. I am thrilled to have her part of our team, and she is going to be supporting a special edition of our podcast series where she is going out speaking to medical professionals, learning about what they do in the day in the life, how they got into the field, and the most important information that they want us as patients to understand and know. So I am so excited for this series. You're going to be hearing more from Sanya, and I really hope you enjoy. Welcome to the conversation.
Hello, everyone. My name is Sanya, and I'm an intern here at SurvivingBreastCancer.org. As a new segment of SBC, I'm starting a podcast segment where I talk to physicians all across the globe about the clinical perspective of a breast cancer diagnosis, as well as new technologies and research coming into the field of breast cancer. I truly believe that this perspective is important in understanding a diagnosis in a way that patients and their families may not have seen it before. I'm joined today by Dr. Kulkarni, a pathology specialist from New Jersey. From a breast cancer perspective, Dr. Kulkarni examines breast samples and biopsies in order to make diagnoses. Hi, Dr. Kulkarni.
Hi, Sanya.
I'm good. How are you?
Good. Thank you for having me today.
We're so lucky to have you on the podcast, and let's just get right into it.
What brought you into the field of pathology, and how long or where have you been practicing?
I've been practicing pathology for over 10 years now. And when I was looking for residency positions, I was looking for a field of medicine which involved every aspect of medicine. I did not want to be honed in on a specialty or an organ system for that matter. I was also looking for something which would get me involved with teams, and it would be a collaborative effort. And then the other thing was I needed something which would constantly challenge me, every new case every day, and also something that would evolve with the newer technologies coming out. And personally, also, I was looking for a field which would give me a good work-life balance. So pathology filled all those areas, and that's how I landed up in pathology.
Mm-hmm. And where do you practice now?
I've been a surgical pathologist in New Jersey. I work with the reference lab. I do their immunohistochemistry, their prognostic markers, and I also do their digital pathology for them.
Yeah, and do you feel that where you practice, especially having practiced in New Jersey for this time, has an impact on how you practice, especially considering the patient population that you are treating?
Definitely. New Jersey, the tri-state area is densely populated. It has a diverse set of population. That way it gives us a good set of patients to see how they respond to the diagnosis, treatment, and the newer changes in the field. And thanks to the proximity of the best academic and research institutions around New Jersey, has given me an opportunity to be involved in the community and also be aware of the recent trends in the breast cancer field.
Yeah, I can definitely imagine how a diverse population and access to academic centers would lead to important research breakthroughs. And just in terms of your role as a pathologist, how do you feel that pathology is able to bridge the gap between laboratory testing and clinical care?
Before, everybody thought that pathologists would be in one corner of the hospital, mostly in the basement, and there would be no interaction with the hospital or the clinical setup. And the most popular field of pathology was mostly forensics pathologists who normally came up on TV and every time a high-profile medical legal case was going on. But recently, role of pathologist in clinical care and patient management has changed a lot. In fact, I feel like we are the foundation for the start of a patient, building a treatment plan for a patient. We not only give a diagnosis to the patient, but we also give diagnosis to the clinical team who can start their planning of the treatment for their patient. So I believe a pathologist plays a very critical role in patient management. And on our clinical pathology side, as we are all aware of, it's a study of the blood, urine, and other body samples, which are where we use molecular microbiology and parasitology technology to give patients a diagnosis, which will help, again, the clinicians to make appropriate diagnosis and treat their patients.
Yeah, absolutely. And I've done a little bit of shadowing, especially under a pathologist over the past couple of years. And I certainly thought that the role of a pathologist was to, sit in a dark room, looking at imaging all day, not really much other than that. But as time has gone on and as I'm talking to you and as I've seen under the shadowing that I've done, pathology really is a very critical role to cancer and to a breast cancer diagnosis in general. And just in terms of what you've seen from on the patient side of things, what do patients and their families know about your role in their breast cancer diagnosis?
Patients don't know that it's the pathologist that reads the samples that is taken from the patient and gives them a diagnosis. Very often they think it's the gynecologist who gives them their pap results, or a urologist that gives them their prostate biopsy results, or a gastroenterologist who gives them the gastric biopsies. So I would like patients to know that it is pathologists play a very keen role in the starting of their diagnosis and the treatment, and also in following them up throughout the treatment to make sure from the start till checking to see if there's any residual cancers till the complete remission. So I would like, and also pathologists making the right diagnosis is very key for the patient's treatment plan. So I think that's what the patients need to know, and that's why they need to make sure they get their biopsies done or read or have a second opinion anytime they feel that for their treatment plan to be on target.
Yeah, absolutely. And you've been practicing for quite some time now, and you've worked in, again, numerous locations. How do you feel that the world of pathology and the field itself has kind of evolved from when you started practicing or when you were in your medical training to now?
Oh, wow. Pathology, like medicine, pathology has come a long way. I guess gone are the days when we all just read biopsies, looked at the histomorphology and made a diagnosis.
Yeah.
And also since the current medicine has changed from the conventional belief of one size fits all, pathology also has changed, and it has played a very key role in the evolving of the precision medicine. Initially, we even now we still do the histopathology diagnosis. That's the main way we diagnose a lesion, ruling it out as infectious versus cancer, but also we have got the privilege of adding immunohistochemical markers and prognostic markers and the newer technologies like molecular therapy and molecular diagnosis and gene sequencing has given us the ability to be more precise with our diagnosis and help the clinician in coming up with a more accurate and patient-specific treatment plan.
Yeah, absolutely. I think as the world continues to evolve, we're seeing all sorts of new technologies and kind of new innovations. The field of medicine is kind of evolving right there with it, and even more so, especially when it comes to pathology, as you were talking about. So then, kind of on that topic, can you talk a little bit about what kind of breast prognostic markers there are, and how do they help lead to a more precise treatment, especially in the oncology setting? If you're confused, or are there any additional tests that you order or recommend a patient have that could be maybe more helpful in making a more tailored cancer treatment plan?
Yes, of course. Prognostic markers basically tell us the course of the disease, the way that a tumor is going to progress, and what needs to be done to prevent the cancer from spreading or making sure it is in remission. So basically, things like even the size of the tumor, the stage of the tumor, the mutations that are present, all are one way or the other markers for the tumor progression. But recently, with the advent of immunohistochemistry, we have started using estrogen receptors and progesterone receptors, which tell us if the tumor has those receptors. And with the advent of hormonal therapy, we have been able to use those for patients with those receptors. The other one most popular is the Herceptin, which is basically tells us if the Herceptin receptor is positive that it's an aggressive tumor, so it has to be dealt, but it has a very good targeted therapy, so the oncologist can use it. And with the targeted therapy, there are excellent results for such HER2 positive patients. The other one is the Ki-67, which is a proliferative index. That one will tell us how proliferative the tumor is, and higher the number, that means the more aggressive the tumor is. So that kind of, again, helps the oncologist decide whether they want to go with which way they want to treat the patient, whether with surgery or chemotherapy or radiation. The other marker is the P53. If that mutation is present, that means the tumor is aggressive and it has a poor outcome. So again, the targeted therapies cater towards these indicators. Sorry, go ahead.
No, sorry.
A lot of research has been done lately, and many new markers are up in the market. But then the good thing is there are also some tumor profiling markers like Oncotype DX and MammaPrint, which will help the oncologist basically see if this is something which will follow the patient after the treatment. So it will tell them whether they are giving them the right treatment, and also check if what are the risks for reoccurrences, and how the clinician has to modify the treatment if the patient is not doing well. So these markers not only help us plan the treatment, but they also follow the progress and also help us tweak the treatment if needed.
Mm-hmm. So something that's kind of been like popping up in the world of breast cancer, and like kind of a phrase that's being and all sorts of research has been liquid biopsy. Can you talk a little bit about that?
Yes, liquid biopsy is the latest one, and it is getting more popular because it is less invasive and also less expensive. It can be done out of the blood sample that is taken off from the patient, unlike the tumor biopsy or the excision we have to go to. So this is helpful because it will check the patient's plasma to see there's any residual cancer cells, and even its minute forms. So that way, this will tell the patient and the doctor that the treatment has worked, or the patient is disease-free, or they have to again treat the treatment. This has been very helpful because the patient will have some sort of relief knowing that the treatment is working and they are getting better.
Yeah, and again, I think it's really interesting to hear how far the medical technology field and research has come throughout your time working as a pathologist and for, as long as medicine has existed. So another question I had was, how does a breast cancer treatment team make sure that a patient doesn't just become their diagnosis? I think a lot of the times when a patient meets with their physician, meets with a specialist, a lot of the times people think that the physician is just going to cure them. They're telling them what medications to take, they're telling them what protocol to follow, and that's it. How does a breast cancer treatment team make sure that they are able to empathize and sympathize with the patient throughout their diagnosis and kind of not make the patient just a statistic, if you will?
Actually, breast cancer is one of the areas where a lot of research has been done, a lot of thought has been gone into. So nowadays, we don't diagnose patients with just breast cancer. There's an entire team that follows the patient once the patient is diagnosed with mass per se. So we have not only from the clinician, a nurse practitioner, a patient support nurse, or a coordinator, or a psychologist, and again, a pathologist, then a surgeon, a genetic counselor, and then a treatment nurse. So the whole team is put together with the patient and the family in mind to make sure that the patient is comfortable with the diagnosis and the treatment plan, and then also all the support within the hospital and outside hospital is provided with the team. And the tumor boards and breast tumor boards are very popular in teaching hospitals because it's nice to see when the whole hospital comes together to help a patient.
Yeah, I think that that's really important for people listening to this podcast to hear. So thank you for saying that. And as technology continues to evolve, how do you feel that you and your team and oncologists in general are really able to keep up with all the research going on?
Yes. ASCO comes up with guidelines every so often, and we have to update our diagnosing and reporting protocols. And as pathologists, we have CAP guidelines that are very rigid for breast cancer, where we follow the protocols to make sure the appropriate templates are followed to make the diagnosis, and every aspect of the tumor progression is noted and reported to the clinician. And continual medical education is always been a part of the medical industry, where we have to keep ourselves updated with the current and evolving trends in the field of medicine.
Yeah, it's actually really funny that you mentioned that, because SBC actually goes to ASCO every year, and we're able to talk to leaders in the field of breast cancer. We're able to talk to physicians, researchers, all sorts of different people and organizations about, their missions and, what they've been doing. So that's just wanted to throw that in there and mention that. So just switching gears to you specifically, what do you feel is the most gratifying part of being a pathologist?
Sometimes pre-diagnosis, I think for a pathologist, I'm talking about both benign and neoplastic, like the screening methods, they're all in place to make sure the patient, whether it's for a pap smear or whether it's for mammograms or the follow-up biopsies, that one kind of makes me feel that even if we stop one cancer from progressing, one lesion from progressing from a pre-malignant to a malignant, it's definitely worthwhile. And then also with the newer advanced screening technologies, if we are able to catch a cancer at the earliest stage and then get the patient the proper treatment and make a difference in their health life, it's definitely gratifying. And then also as pathologists, like I said, we are the bearer of the bad news. We start with when it can be a benign fibrocystic change or it can be a cancer. So sometimes the guilt is on us that we started the bad news, but then also we make sure with the entire medical community, we are with the patient from diagnosis to giving our prognostic markers. We're helping the oncologists come up with a treatment plan and following them up through their treatment, looking at the biopsies again post-treatment, and then also after the treatment to make sure they're in remission and they're in a better health phase. We get a lot of post-treatment resection specimens where we make sure there's no tumor at the margins and all the rest of the breast tissue is benign. So that is very gratifying, and each patient treated or each patient helped is the ultimate goal of every medical profession.
Yeah, absolutely. And what kind of misconceptions do you think that cancer patients, or in this case, breast cancer patients, may have about their diagnosis or what a physician is doing?
It is getting the cancer diagnosis is very intimidating. I've seen many patients, though everything is in place, after the initial shock wears off, there's so much information, there's so much available, but where to start is a big question. I've seen patients struggle with it. So that is overwhelming, and they feel they're alone. They feel they're left out. They don't know where to start. And many times they're advised to get a second opinion, and then they have to pick between two difficult choices. And again, it's very frustrating for someone who is not in the medical field. So for them, I would recommend is seek all the advice, be aware of the newer developments, get a second opinion, and go to support groups and get the right help. So that way it will help you be a proponent of your own treatment plan. And again, like I said, the whole team has a common end goal of making sure the person ends up with no cancer. So we're all here to help, but they need to seek that information, and it is available.
And on that note, what advice would you give to anyone listening about diagnostic testing and kind of making sure that they're staying up to date on all of that?
Yeah, a lot of, since breast cancer is one of those cancers which is less aggressive, it has given us more options to do more research. A lot of the new evolving changes are happening constantly, and there's a lot of targeted treatment that's available. So I would say for anyone diagnosed with breast cancer or has a family history of cancer, be aware of the screening methods that are available. And once they have a diagnosis, please stay informed. The more information you have is good. Be aware of the new changes and seek out for facilities that provide the newer treatment options. Get involved in clinical trials if you fit the criteria. Like I always said, you are your best advocate, and don't be afraid to ask questions, and the clinicians will help you get there.
Yeah. Thank you so much. And then finally, what is the biggest advice you can give to anybody listening today, whether that's a patient, a family member, especially when it comes to like a difficult diagnosis?
Best advice. Stay strong. Again, like there's a lot of options. There's a lot of new research being done. It is a hard battle, but there is there's light at the end of the tunnel. So keep persistent, reach out, get the best treatment. And fortunately, we all have the means and resources to get the treatment since it's available here. So I would say is reach out and seek out and get the best treatment possible.
Yeah, thank you so much, Dr. Kulkarni. Your insight and knowledge has just been so amazing, and getting to hear your advice to patients and their family members is truly going to be something that people will be able to take away from this podcast and, bring into their lives. So again, thank you so much for joining me, and it's been lovely talking to you.
Thank you, Sanya. It was good talking to you, and good luck with all the future podcasts.
Thank you so much.
And thank you, everyone, for listening to our show. I would like to acknowledge that all of the information on our podcast are from personal experiences and are not a substitute for professional medical advice. You should always contact your medical care team. Let's keep the conversation going. You can follow us on Instagram at survivingbreastcancer.org. Also, follow our podcast at Breast Cancer Conversations. Or if you're looking for more personal connections and behind-the-scene sneak peeks, feel free to follow me and William at Laura and Will. We would love to hear from you and to connect. I would also be remiss not to mention that our podcasts are made possible because of donations from our listeners like you. So if you love our pod and our content and want to support the work that we are doing for our nonprofit, please feel free to hop on over to survivingbreastcancer.org/donate to make a contribution. Every bit helps. Finally, if you're looking for more ways to connect, check out our jam-packed calendar of programs at survivingbreastcancer.org/events. Thank you for being you, sending you light and love to keep on thriving.